Good day, everyone. This is Hazel, your LET partner. Today, I will discuss learning disorders. These are conditions that affect how individuals receive, process, and respond to information. Learning disorders may influence skills such as reading, writing, mathematics, attention, and organization. As future teachers, understanding these disorders is important so that we can support learners who experience difficulties in school. In this presentation, we will explore the types of learning disorders, their characteristics, and strategies teachers can use to support learners. Learning disorders are neurological conditions, meaning they are related to how the brain functions. They affect how learners process information and perform academic tasks. These conditions may influence reading, writing, mathematics, attention, or even organizational skills. It is important to remember that learning disorders are not related to intelligence. Many learners with these conditions are capable and intelligent, but they learn in different ways and may require additional support. A learning disorder refers to persistent difficulty in learning academic skills, even when the learner has normal intelligence and proper educational opportunities. These difficulties usually become noticeable when children begin formal schooling. Because learning disorders affect how the brain processes information, learners may require specialized instruction, additional time, and supportive learning strategies to succeed academically. Learning disorders can be categorized based on the academic skills affected. Some disorders affect reading, while others affect writing or mathematics. There are also disorders related to language processing, attention, and executive functioning, which influence how learners focus, plan, and organize tasks. First category, the reading-related disorders. One of the most well-known reading disorders is dyslexia. Learners with dyslexia have difficulty recognizing words, reading fluently, and connecting letters with sounds. Another condition is hyperlexia, where children can read words at an early age but may struggle to understand the meaning of what they read. Some learners also experience reading comprehension disorder, where they can read the words but have difficulty understanding the text. Second category, writing-related disorders. A common writing disorder is dysgraphia. This condition affects the learner's ability to write clearly and organize ideas in written form. Students with dysgraphia may have messy handwriting, difficulty forming letters, poor spelling, or problems expressing their ideas on paper. Since writing requires coordination between language processing and motor skills, learners with dysgraphia often need additional support. Third, math-related disorders. Dyscalculia is a learning disorder that affects mathematical ability. Students with dyscalculia may struggle to understand numbers, recognize mathematical symbols, or remember math facts. They may also experience difficulty performing calculations, telling time, or estimating quantities. Fourth category, language and processing disorders. Some learning disorders involve problems with processing sensory information. For example, auditory processing disorder occurs when learners have difficulty interpreting sounds in spoken language, even though their hearing is normal. Another condition is visual processing disorder, where learners struggle to interpret visual information such as letters, shapes, or symbols. There is also information processing disorder, which affects how the brain processes and stores information. Another condition is nonverbal learning disorder, where learners struggle to understand nonverbal cues such as facial expressions and body language. Nonverbal learning disability, NVLD, characterized by strong verbal skills but weakness in interpreting nonverbal cues like facial expressions and body language, as well as poor motor coordination. Additional learning disorders. Other conditions that may affect learning include dyspraxia, which affects motor coordination and movement. Dyspraxia, developmental coordination disorder, impacts motor skill development, affecting balance, coordination, and fine motor tasks like tying shoelaces. Another condition that strongly affects learning is ADHD, or attention deficit hyperactivity disorder. Learners with ADHD may find it difficult to maintain attention, stay organized, or control impulsive behavior. They may become easily distracted or struggle to remain seated during activities. Although ADHD is primarily considered a behavioral and attention disorder, it can significantly impact academic performance and classroom learning. Another challenge that affects learning is executive functioning issues. Executive functions are the mental skills that help individuals plan, organize, focus, remember instructions, and manage time. Students with executive functioning difficulties may struggle to complete assignments, follow multi-step instructions, or organize their materials and schedules. Teachers should observe signs that may indicate learning difficulties. These signs may include difficulty reading, writing, solving math problems, following instructions, or remembering information. Learners may also have problems with attention, organization, and completing tasks. Teachers can support learners with learning disorders through different strategies. One effective approach is multisensory instruction, which uses visual, auditory, and hands-on activities, providing clear instructions, allowing extra time for tasks, and using assistive technologies such as audiobooks or speech-to-text tools can also help learners succeed. Teachers play a vital role in supporting learners with learning disorders. They must be able to identify early signs, adapt teaching strategies, and create inclusive classrooms. Teachers should also collaborate with parents, guidance counselors, and specialists to ensure that learners receive proper support. In conclusion, learning disorders affect how individuals process and understand information. These disorders may influence reading, writing, mathematics, attention, and organization. However, with early identification and appropriate support, learners with learning disorders can succeed academically. As future educators, it is our responsibility to create inclusive and supportive classrooms where every learner has the opportunity to succeed. Before we finally end this video, let's test your understanding. Make sure to get your notes. Let's do it! 1. Which learning disorder primarily affects reading and word recognition? A. Dysgraphia. B. Dyscalculia. C. Dyslexia. D. Dyspraxia. C. Dyslexia. 2. A student who has difficulty with handwriting and organizing ideas in writing may have which disorder? A. Dyslexia. B. Dysgraphia. C. Dyscalculia. D. ADHD. B. Dysgraphia. 3. Dyscalculia mainly affects a learner's ability in which area? A. Reading. B. Writing. C. Mathematics. D. Speaking. C. Mathematics. 4. A condition where learners have difficulty maintaining attention and controlling impulsive behavior is called A. Dyslexia. B. ADHD. C. Dyspraxia. D. Hyperlexia. ADHD. 5. Which disorder involves difficulty interpreting sounds and spoken language despite normal hearing? A. Visual processing disorder. B. Auditory processing disorder. C. Dyscalculia. D. Dysgraphia. Auditory processing disorder. 6. A disorder that affects motor coordination and movement is called A. Dyspraxia. B. Dyslexia. C. ADHD. D. Dysgraphia. Dyspraxia. 7. A child reads words at an early age but struggles to understand their meaning. This condition is called A. Dyslexia. B. Hyperlexia. C. Dysgraphia. D. Dyscalculia. Hyperlexia. 8. A learner has difficulty interpreting facial expressions, gestures, and other nonverbal cues. What disorder may this indicate? A. Dysgraphia. B. Nonverbal learning disorder. C. Dyslexia. D. Dyscalculia. Nonverbal learning disorder. 9. A learner who has difficulty organizing thoughts, planning tasks, and managing time is experiencing problems with A. Reading comprehension. B. Executive functioning. C. Visual perception. D. Motor coordination. executive functioning. 10. Which professional practice helps teachers identify learners with possible learning disorders? A. Ignoring the learner's behavior. B. Continuous observation and assessment. C. Giving more homework. D. Reducing class activities. B. Continuous observation and assessment. I hope you aced this quiz. If not, don't worry. I added 5 bonus questions. Here they are. The following questions are scenarios. You have to identify what learning disorder is observed. Okay, let's begin. 1. Maria reads slowly and often confuses letters such as B, D, and P. She struggles to recognize words and has difficulty understanding what she reads. A. Dysgraphia. B. Dyslexia. C. Dyscalculia. D. ADHD. Dyslexia. 2. John understands math concepts but struggles to recognize numbers and perform calculations. He also finds it difficult to remember multiplication tables. A. Dyslexia. B. Dyscalculia. C. Dyspraxia. D. ADHD. Dyscalculia. 3. Anna has messy handwriting and often finds it difficult to organize her ideas when writing essays or reports. A. Dysgraphia. B. Hyperlexia. C. ADHD. D. Dyspraxia. Dysgraphia. 4. Zeth cannot stay seated during class, easily gets distracted, and often interrupts the teacher while speaking. A. Dyscalculia. B. ADHD. C. Dysgraphia. D. Hyperlexia. ADHD. 5. Kyla forgets instructions, loses school materials, and has difficulty planning and completing assignments on time. A. Executive functioning issues. B. Dyslexia. C. Dyspraxia. D. Hyperlexia. A. Executive functioning issues. We hope this activity helped you better understand different learning disorders and how they affect students in the classroom. That's for today, and see you on the next videos.